Some forms of chest pain do not shout. They simply change how you move, how far you walk, how much stress you can tolerate, and how much trust you place in your own body. You take your medications exactly as prescribed, you follow instructions and do your best, but something still does not feel fully settled. When those symptoms continue despite your best efforts, life naturally becomes smaller and far more guarded. This brings up a difficult reality in modern cardiology. Often, a patient continues to have angina even when their major coronary tests show nothing that fully explains the pain. Looking past the large coronary arteries reveals the microscopic network of the heart's finer circulation, the site of microvascular dysfunction. Because standard large vessel treatments target major blockages, they often cannot reach or repair flow restrictions within these microscopic channels. Addressing a problem in this tiny, intricate network requires a different perspective than what large vessel cardiology typically provides. Traditional Chinese medicine frames this specific circulatory gap as heart blood stasis, a pattern where circulation struggles to move smoothly through the heart's finer channels. This pattern typically presents as a fixed chest pain that predictably worsens in cold weather or at night, and it often appears alongside visible signs like dark sublingual veins under the tongue. In this framework, there are practical triggers that provoke the pain. Emotional stress can lead to qi stagnation, a blockage of energy, while exposure to environmental cold causes physical constriction in those already narrow vessels. Other pathways include metabolic obstruction, like heavy foods bogging down the system, or underlying deficiency patterns, where an older or fatigued heart simply lacks the functional force to push blood through the microcirculation. Recognizing these observable triggers helps explain why symptoms flare in certain people under specific conditions, and why a standardized treatment protocol leaves some individual needs unmet. The 5 Essences herbal approach addresses these triggers by focusing entirely on the outside of the body. There is no pill, powder, or liquid to swallow. Instead, a flat, softly stitched fabric pouch is placed directly at the navel, an acupuncture point known as Shen Kui, CV8, held in place by a light, breathable belt. Within the traditional Chinese medicine framework, this works through herbal qi interacting directly with the body's meridian network. This is not transdermal absorption, and it makes no modern drug delivery claims. By completely bypassing the digestive system, it offers targeted microvascular support without adding a single new compound to the liver's daily processing burden. This routine is designed for daily life. A single pouch is worn continuously for up to 72 hours, with 3 pouches completing a standard 9-day cycle. We can look at a 2025 retrospective case series to understand how this is used clinically. This chart illustrates that series, which involved an exceptionally small sample size of just 6 angina patients. The series reported a rapid response in the acute cases and meaningful symptom improvement in the chronic cases. However, it is crucial to note the limitations of these findings. This was a retrospective study from a single practitioner with no control group, meaning it cannot establish medical causality. While this observational data does not prove a clinical cure, the documented symptom relief in these specific patients offers a reason for careful consideration. There are strict boundaries for this approach. It is intended only for stable, medically managed angina. It is never a substitute for treating new, severe, or changing chest pain. Patients must continue all prescribed cardiac medications, keep their nitroglycerin readily available, and keep their cardiologist informed of any complementary routines. The pouch functions as a disciplined, complementary layer of support that exists safely alongside your standard cardiology regimen. Persistent chest pain often points to finer circulatory patterns that respond well to a gentler, routine-friendly lens alongside your standard medical care. If a non-pill, external approach feels appropriate for your situation, this method offers a dignified option to explore, carefully and thoughtfully, with your medical care securely in place.